Jackson Neurosurgery Clinic Controlled Substances Policy. The purpose of this policy is to protect your access to controlled substances and to protect our ability to prescribe for you. The long-term use of controlled substances is controversial because of uncertainty regarding the extent to which they provide a long-term benefit. Opioids may cause drowsiness that can be worsened with alcohol, benzodiazepines, and other sedating medications. An overdose can cause severe side effects, even death. Other common, usually temporary side effects include nausea, itching, and sweating. Psychological depression and lowered testosterone levels in men may also occur. Sleep apnea, if present, may be worsened by opioids. If your physician determines that you are at risk for sleep apnea, evaluation and treatment for this problem may be necessary before starting and/or increasing dosages of some medications. Constipation commonly occurs and often does not improve with time. It is impossible to predict opioid side effects in any individual patient. Having side effects on one opioid does not necessarily mean that there will be side effects on another opioid. Additionally, there is also the risk of an addictive disorder developing or relapse of a prior addiction, and the extent of this risk is not certain. Because these drugs have potential for abuse and/or diversion, strict accountability is necessary when use is prolonged. For this reason, the following policies must be agreed to by you, the patient, as consideration for and a condition of the willingness of the prescribing physician to consider the initial and/or continued prescribing of controlled substances to treat your chronic pain. All controlled substances for treatment of your condition must come from one physician or, during their absence, by the designated covering physician. If you happen to visit the ER or have surgery, you must notify the clinic as soon as possible. Multiple sources of controlled substances can lead to adverse drug reactions and poor coordination of care. All controlled substances must be obtained at the same pharmacy. Should the need arise to change pharmacies, our office must be informed as soon as possible. Your choice of pharmacy will be recorded in your chart. You may not share, sell, or otherwise permit others to have access to these medications. You may not take other people's medications. This includes family members. Both of these activities are illegal and may result in your prosecution on criminal charges. You will take only the medications that you are currently prescribed. Saving up or hoarding medications is not permitted. Do not take your medications at a greater dose or frequency than what is prescribed. The directions on the prescription bottle are there for a reason. They are not general suggestions. Please read and adhere to them. If you cannot read them or understand them, your pharmacist or one of our staff will be happy to clarify them for you. You may not take old leftover medications to supplement your current treatment. We expect you to inform our office of all medications, medical conditions, and adverse reactions that you may have. You are giving the prescribing physician your permission to discuss all treatment details with the dispensing pharmacist and any other professionals who provide your health care for purposes of coordinating care and maintaining accountability. Unannounced urine or blood toxicology testing will be requested, and your cooperation is required. You are responsible for the cost of this testing, whether or not your insurance coverage policy covers the testing. The presence of unauthorized or illegal substances may result in discontinuation of controlled substances, changing or eliminating medication, requirement of more frequent monitoring, titration down in dosage, or referral to an addiction medicine specialist. Additionally, if the prescribed medication is not found in your urine, discontinuation of the medication, closer adherence monitoring, or changes in the dosing schedule may be necessary. Refilling of your medication is contingent on you keeping scheduled appointments, not just with your physician, but also with recommended consulting physicians, therapists, and psychological professionals. You will comply fully with all aspects of your treatment program, including behavioral medicine, psychologic and/or psychiatric, and physical therapy if recommended. Failure to do so may lead to discontinuation of your medication and a referral to another provider or treatment center. Successful pain management entails employing multiple interventions, including active participation in regular exercise and the use of psychological coping strategies. A pattern of passive reliance on medications, resistance to more active physical treatments, and repeated failure to demonstrate the implementation of psychologically based coping strategies that have been taught to you may lead to discontinuation of medications and/or referral to another provider or treatment center. Refills will only be made at the time of a scheduled clinic visit. Medication refills, medication changes, or other medical issues will not be managed in a surgical center setting or at the time of a scheduled procedure. These types of issues will only be discussed and/or managed at a scheduled clinic visit. If you cancel or no-show for your appointment, we will not refill your prescription until you are seen in the clinic. Refills will not be called in. Please do not ask or expect them to be. Multiple cancellations or no-shows may result in dismissal from our practice. It is your responsibility to always bring your medication in the original containers to each office visit. If you fail to bring your medication to your office visit, you may be required to reschedule your appointment and/or go to your pharmacist for a pill count to verify compliance with the prescribed instructions. Failure to bring your medications to your office visit, therefore, may result in added medical and travel expenses. It also may delay the timely refilling of your medications. The safeguarding of your medications is your responsibility. Your prescriptions and/or medications will not be replaced if they are lost, stolen by someone, including relatives, get wet, are left somewhere by mistake, fall down the drain or toilet, or are eaten by animals, etc. No exceptions will be made, and early refills will not be given. Physical dependence will develop with regular use, but does not by itself indicate addiction. This means that a withdrawal syndrome will likely develop if you stop your medication abruptly. Your medication should not be stopped abruptly, as an abstinence syndrome or drug withdrawal will likely develop. Tolerance may develop to the pain-relieving effects of opioids. This means that the pain relief may decrease over time, but in chronic pain states, this usually occurs slowly, if at all. Your medication may be hazardous or lethal to a person who is not tolerant of their effects, especially a child. You must keep your medication out of reach of such people. Your medication may be hazardous or lethal to animals, therefore you must keep them away from your pets or other animals. Your medication may impair your ability to participate in potentially hazardous activities, drive a vehicle, or operate machinery. This impairment can result in serious injury and/or death of yourself or others. Your prescribing physician does not give clearance or approval to participate in potentially hazardous activities, drive a vehicle, or operate machinery while under the effects of your medication. If you engage in these activities, you do so at your own risk. It is your responsibility to notify your employer and/or the DOT, Department of Transportation, if your employment involves potentially hazardous activities, driving a vehicle, or operating machinery. If necessary, you can request that we refer you for evaluation of your driving abilities and/or your reaction times. The extra cost of this evaluation will be your responsibility and is not covered by many health insurance plans. where medications may be sought after by individuals with chemical dependency or addiction and should be closely safeguarded. It is expected that you will take the highest possible degree of care with your medication and your prescriptions. It is your responsibility not to leave your medications or your prescriptions where others might see or otherwise have access to them. If the responsible legal authorities have questions concerning your treatment, as might occur, for example, if you were obtaining controlled substances at several pharmacies or from several different sources, all confidentiality is waived and these authorities will be given full access to your records of prescribing controlled substances. It is important that you understand that your medical treatment is initially a trial and continued prescribing of controlled substances is contingent on evidence of benefit. We understand that emergencies can occur and under some circumstances exceptions to these guidelines may be made. Emergencies will be considered on an individual basis. Not all pain conditions respond to opioids. Some pain may only be partially responsive to opioid therapy. Total elimination of pain is an unrealistic goal. Escalating dosages may indicate that opioids are not effective or that there is an underlying problem with addiction or psychological dependence. Discontinuation of opioid medications may need to be done under these circumstances. Not enough pain relief, persistent side effects, not achieving goals of opioid treatment, such as improvement in function, problematic dose escalation, or inability to comply with the treatment agreement.